Well, I would like to welcome everyone to today's webinar. Thank you for joining us. We're having a little bit of technical difficulty, but we're so grateful, so very grateful that you're here.
Yeah.
I'm Felicia, and I'm with Felicia Warner with uh, the Area Agency on Aging. And I'm Marty, I don't know about you, but I'm excited about this webinar today because it's such a needed subject with the Medicare Savings Program and with the S&P fake government imposters, doggone it. They're out there, they're scamming people, but we're going to learn so many new things and we'll have an opportunity to ask questions and, just network with others and just make sure you take away some valuable information. So
Okay.
I am
Okay.
excited about it. I really am.
Simon, I'm going to check with you. Were you able to solve what you were doing?
I was trying to see if I could get the file the slides, and I can't get to it. I don't know
Okay.
what
Okay.
it's,
That's all right.
yeah.
Okay. Well, we're going to roll. And Felicia, thank you thank you very, very
Yes,
much.
I'm excited.
Welcome everybody. I want to welcome you. We are here. My name is Marty Mascari. I am a contractor with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, both of which are under the umbrella of the North Central Texas Council of Governments in the greater Dallas-Fort Worth, Texas area. Although our service area is the greater Dallas-Fort Worth, Texas area, we invite everybody from anywhere to join us, and we're glad to have you today. We are thrilled to have my cohorts at that work with the SMP, the Senior Medicare Patrol at the Area Agency on Aging, and we're also thrilled to have our partners at the Better Business Bureau Education Foundation out of Houston. And as Felicia said, we're going to be talking about Medicare savings programs and the fake government imposters. But before we get started, I want to go over real quick the information on CEUs for those of you that are looking to get CEUs for joining us today. Today's webinar, we are offering complimentary CEUs for licensed social workers and licensed professional counselors in Texas. We are also offering certificates of attendance for anyone who's looking for those. If you have a different license in Texas or a license outside of Texas, feel free to go through the process and get a certificate, but please know that there's no guarantee that your jurisdiction will take them. But I will note that I've had people tell me they've been able to use them for other licenses. And I've also had other jurisdictions reach out to me for more information about the event so that they can decide whether it passes their threshold for the education they're looking for. Today's webinar is worth 1.5 hours of CE credits. You must complete the entire live webinar and the Q&A in order to qualify. Please note you're not required to go beyond the advertised time of 11:30. So if we go past 11:30, which we often do because of questions, you're not required to go past 11:30 if you have other commitments and need to move on. You must complete the Google evaluation survey, but that should pop up as you close out of Zoom today. It will give you the opportunity to take a very short survey. That is our Google survey, but the survey will also be emailed out to you in the follow-up email as well, the survey link. That link will be available to you till the 21st. And please give us till till the end of April or the 21st of April to get those certificates out to you. Now, Felicia, I'm going to turn it over to you and let you introduce Leslie, if that's all right.
That is fine. That is fine.
That would be wonderful.
Thank you so much.
Okay, Simon, let me ask Simon real quick. Are you wanting to try to pass it off, Simon, or would you like me to just run through it?
No, I got the file. I think we can do it. I got it.
Okay, great. I'm going to stop sharing and let Simon take the keys.
You got it.
Okay. Well,
There
I'd
you go.
like to introduce Leslie Kilton. She is our presenter today, a lovely person. And you know what? I was so amazed when I learned that Leslie did sign language, and I've been just enchanted with learning. I only know one sign language, which is bad. But anyway, Leslie, thank you so much for presenting this information today. The Medicare Savings Program is an awesome program, and I think a lot of people don't know about it. And as Leslie will explain, this is something that will enhance our low-income community members very much. And so Leslie has been with us it's over a year.
Yes, it
And
is over a year.
and it's been great to get to know her and learn more about sign language. And she is a wonderful human being, and she's just been wonderful with our team. And of course, Simon and myself and our fearless leader, Melinda, and she is unavailable today, or she would be with us. Thank you again, Leslie, and here you go.
All right. Well, welcome everyone. I'm so glad you're all here with us today. We're going to learn about these Medicare savings programs. There's a lot to learn, and go ahead, Simon, the next one. And all of us, we're the benefits counseling team, and all of us can do these Medicare, can help assist people with the Medicare savings application. And unless they want to do it themselves, and we can kind of walk them through it if they have any questions. So anyway, all right. So we're going to talk about who we are as a SHIP. We are a state health insurance assistance program. I know there's no A in SHIP, but the assistance. So it was established by Congress, and we're funded by the U.S. Administration for Community Living at the U.S. Department of Health and Human Services. Okay. And then we can help in lots of different ways. We can help with understanding cost and coverage. We can compare options for you. We can enroll you or change plans, and we can help correct billing issues. And that's just a little bit of what we can do. I think we do more. So, all right, this is how to find your SHIP center. It's on the back of your Medicare book, no matter what state you're in. And you can just call this number for free personalized health insurance counseling. And they want this number here is that's not the state one. That must be the national one. But every state has their own number, and then you just give them your zip code and they send you to the right SHIP office. Okay. Okay, so here's what we have. We have 54 SHIPs. There's one in every state, including Puerto Rico, Guam, DC, and the U.S. Virgin Islands. There's 2,200 local programs, 12,500 counselors, and we're educating 4 million at least. And then we have over 2.5 million counseling sessions. So that's good. Now, these are the services we offer at our area agency on aging here in North Texas. And we have services for older adults, and we have services for the caregivers of those older parts. Oops, wait a minute. Sorry. My watch is talking to me. So we have all these services, and if you need a brochure, just call us. We can get one sent out to you. So, and we can also provide services for people who with disabilities of all ages, and this is their Aging and Disability Resource Center. Okay, and that's for people of all ages. All right, now we want you to come and work with us. We are a great team. We are lots of fun, And so if you need to volunteer, you could learn all this stuff and go through the benefit counseling training and go through the senior Medicare patrol training, and you could get out in the community and talk about it. And we're always looking for volunteers, and we are a great group to work with. We're lots of fun, right, Simon and Felicia? So we have
Yeah.
we have lots of volunteer opportunities, and Sharon Robon is our volunteer coordinator, and she's wonderful. So if you need, contact us, and we'll be glad to get you in touch with her. And also, we can get you in touch with the benefit counseling and the SMP training. So, okay. So here are the program opportunities. You can be a volunteer benefit counselor. You can be a volunteer senior Medicare patrol person who goes out and explains what Medicare fraud is. You can be a long-term care ombudsman and help people in assisted living. That's very important because they just often don't know who to talk to. And then we have here several health evidence-based programs, and that is a matter of balance. And then we have chronic disease self-management classes and diabetes self-management classes. And we have people that teach them. We've had one woman who's been volunteering with us for over 9 years. So we have a great group of volunteers, and we're very supportive. So next. Okay, so then these positions, you can choose how and when to serve. And you can, lots of people say they're not available for a certain period of time. And it can work in your community, and you'll get lots of training. You have to have background verification. We do a lot of continuing education to keep up with the information as it changes. So, all right, there's Sharon's phone number. Call her or call any of us even. So, okay, we hope you'll sign up. So. All right, next. Okay, here are the Medicare savings programs. This is our goals today. So we're going to learn why they're so important, what they are, what the financial eligibility guidelines are, how to apply, and other ways to lower your costs, and where to get more information. Okay, and know that these Medicare savings programs are federally funded. Each state administers them. And it's for people with limited income and resources, and it helps pay some or all of the Medicare premiums, deductibles, copays, and coinsurance. All right, so these are the general requirements. You have to be living in a state, you have to be 65 or older, or and receiving Social Security disability benefits, one of these, you don't have to have all of them. And then if you have certain disabilities or permanent kidney failure, even if you're under age 65, you can qualify. And then you have to meet the standard income and resource requirements. And every state does this, and every state has their own income requirements. So, all right. So the Medicare Savings Program is kind of I like to think of it as like an umbrella thing, and there's 4 tiers within it. We'll say right now that the qualified disabled and working individuals, we don't do too much with that. But the other 3, so the qualified Medicare beneficiary is the income is the least and the benefits are the most. And then you have specified low income Medicare beneficiary, SLMB, or people call it SLIM or something like that, and then the qualifying individual. Those 2, they pay for the Part B premium every month. So they would save $185. Okay, next. All right, so do we think that these programs are worth it? Absolutely. They're very important. So the Medicare saving programs are essential to the economic security and health access for millions of Americans, people with low incomes. So for 2025, here are the Medicare Part A costs. The deductible is $1,676 per benefit period. The Part A hospital copays are the first 60 days is the deductible. So the days 61 through 90, the copay is $419. And then if you stay in even after 90 days, 91 through 150 is $838 a day. And then Part A, a skilled nursing facility copay is $2,009, $209.50 daily for days 21 through 100. And then the Part A monthly premium can be up to $518 if you did not have enough quarters to get it for free or partially reduced. So the Medicare Part B costs, the annual deductible is $257. Well, let me just explain. The Part A hospital deductible, the benefit period starts when you enter the hospital and continues until you're out of the hospital for 60 days. If you keep going back in and out of the hospital, it's the same benefit period. But when you have a 60-day break, then it starts a new benefit period. But the Part B deductible is annual, it's for the whole year. And then the monthly premium in 2025 is $185. And then they pay 80%, and then your co-insurance is 20% of Medicare allowed fees. Okay. So we know that poverty is pervasive with Medicare, older adults, and these are the Medicare beneficiaries and the poverty lines. So there's just they just live above federal poverty level. So that's tough. Okay. Next slide. So, and then a lot of people don't know about these Medicare savings programs. So it's up to us to get the word out. I tell a lot of people about them. I'm sure we all do. Some people call in knowing about them, and some people, Anyway, but these are the participation rates. So look at how many are enrolled and how many are eligible. The light blue is the eligible but not enrolled. So it's up to us to get this word out, to tell people about it, to screen them, because we can give you we have the income requirements. So, all right, next one. So they often lose coverage. So it is a complicated procedure sometimes. It doesn't really have to be, but of course it is. So if their income goes up for any reason, then they might get their benefits would be discontinued. But they still get on and off Medicaid a lot. So, but we want to keep them on it. So, next one. All right, and so here are the guidelines this year. All right, so you can assume that if you look at the qualifying individual, most states it's 1781 and for an individual and 2400 for a couple. If they make that or less, then they qualify for the rest of the programs actually. So I always start with that one, but then if it looks like sometimes they'll tell me how much they make and then we can tell them. But the QMB, if it's 1325 or less, then that's the most benefits they'll get. That will pay for just about everything. Co-pays, deductibles, premiums. So, all right. And then they have to have assets. Their assets do not include a house or a car or stuff in their house. It's just their retirement accounts or pensions and that kind of thing. And they have the asset limits there. It's 9,660 for individual and 14,470 for a couple. All right, so they have to be below that, and there are different ways to get there. So, next one. Okay, so this is the financial eligibility guidelines. So, if your income seems above it, you should still apply. They may not, some things may not be counted. So in all states, the first $20 of your monthly income is not counted. And then if you're working, the first $65 of your monthly wages are not counted. And then food stamps are not counted. And then half of your monthly wages after the $65 is deducted. some states exclude more of your monthly income than the examples listed above. So, but in all the states, your house is not counted. Your car, you can have one car, all your household goods, any burial funds up to $1,500, and life insurance with a cash value of less than $1,500. So submit that all to the state and they determine. So, okay, so how do you apply? Well, you can call us, your SHIP center, and we will help you to determine that. Or you can call Medicaid. If you are eligible, if you have or eligible for Part A, if your income is at or below the income limits, and if you have limited resources, then you can go online. It's called yourtexasbenefits.com here in Texas. That's the website, and that says the little boxes apply for benefits. You can use the form is the H1200 EZ. That's the easy one. It is not too bad. And then even, just fill out an application or call us and we will help you do that. Okay. Okay, so this is the Medicaid State Recovery Program. If you know about it, it does not apply to these programs. It applies to all other things, like if you have other Medicaid waiver programs, which is the community attendance services, support service, community living assistance and support services, and deaf, blind with multiple disabilities. So Star Plus waiver. So when people ask if they're going to come back and try and get my money, you can tell them not with this program. So, okay. Now there are other ways to lower your costs. In addition, so this application is through Health and Human Services, but the Extra Help program, which Simon discussed last month, is handled through Social Security. So they can help you lower your cost as well. And usually if you qualify for the MSP, you'll also qualify for this because their income limit is a little bit higher. It's $1,906. So, okay. And so Extra Help is a federal program, whereas the Medicare saving programs are handled by the state to help people pay for Medicare prescription drug costs. And again, they have limited income and resources, and they can pay no premium or a reduced premium, and then small co-payments. Now, the Texas benchmark, this 2837, is for the last year's amount. That didn't get updated. So this year, wait, let me find it here, is $18.30 for 2025. So that means they will pay for your premium up to that amount, $18.30. Okay. So if you qualify for Extra Help and you have not applied for the Part D, Medicare Part D, and there's a penalty involved, then you will be waived from the penalty. And then there's a special enrollment period. So, okay. So Extra Help is $19.76 per month. That's your income. So that's higher than the Medicare Savings Program. So if you qualify for this, you'll qualify for the other ones, most likely. And then the couples is $2,664 a month, and resources are the individual can have $17,600, and the couple can have $35,130 a month. Okay, again, the following assets are not counted: your house, one car, your household goods, burial spaces. It's the same as the Medicare Savings Program. And then when you get the Extra Help, when you're approved for it, then this is what you pay. Depends on how much income you have. So if you're below the federal poverty level, that's the least amount you'll pay. It's up to $1.60 for generics and up to $4.80. And then If you're above the federal poverty level, but you still qualify, then it's $4.90 for each generic drug and up to $12.15 for each brand name drug. I know that Medicaid did, or Social Security sent out letters to people telling them that this was going to go up, and we got a lot of calls, but we explained to them that still it was up to that amount. So, okay. Okay, so to apply, you can call your local SHIP center and we can help you do that, or you can call Social Security. And really, it's really easy. You just get online. It's ssa.gov and you fill out the form. And then when we help you, I like that fact that we put our name on it as it's providing assistance. So I feel like it's more credible or more trustworthy. So. And it goes straight, when we do it online, it goes straight into SSA. It takes about 3 weeks to get an answer. Okay, so you remember that the Medicare Savings Program is state and the extra help is a federal. It's also called the low income subsidy. So both those names mean the federal program. And they can have both. Everybody can have both. So, all right, so now this is the page when you go to medicare.gov. If you wanted to look for health and drug plans, it's also good to create your own account for if you're over 60, if you have Medicare, I guess. That way, when Medicare sends out their supplements, notices about how much they paid, they send them out quarterly. But if you wanted to know the information sooner, you could get online and look at your claims online. You can find a new care provider, and then you can talk to people at Medicare. So, and then this is what we use to help people find health and drug plans. And I often tell them that it's available to them as well if they have a computer. It's open for everybody, and you don't need to make an account. Next. Okay, so here we are. We're coming into the middle of March, and the open enrollment period ends March 31st for Medicare Advantage again. So this period was from January 1st to March 31st. It'll open up again October 15th through December 7th. So you still have time to make a change if you need to. If you want to talk to somebody, it's always good to look at it. Okay. Okay, so now we know why it's important to look into these Medicare savings programs for yourself or for anybody. I tell lots of people about them. And then if you want more information, you can always call your SHIP counselor. You can call Health and Human Services and ask them about it. You can get online and apply. It is a little complicated when you're applying. It takes about 60 days, but just know if you work with us, we will stay with you the whole time and help you out. We can call the Health and Human Services office and see what the status is and that kind of thing. So, all right. Any questions? Do we have questions? All right. There's our information. This is where we are. And we handle the 14 counties, all the counties, but Dallas and Tarrant. And they have their own area agency on aging if you need to talk to them. And then this is how to get in touch with us. Okay. Now we're going to go on. Let's see here. I guess that's all. All right. Now I think we're going to let Veronica talk to us about the Senior Medicare Patrol. We also work closely with them. We educate people, and then when we have people who have suspicions of having fraud occur, we refer them to the Houston office. And Veronica has got lots of good information for us today. Even though her name says it's Angel.
Yes.
I'm just sure she's an angel anyway.
Yeah, I'm
Okay.
sorry about the name.
No, you're fine.
Yeah, the
Veronica,
thing does say
are you
Angel.
wanting to share your slides?
I can do that, yes, if you like.
I know that was a plan. I just wanted to make sure that's what you wanted to do.
Yeah, I can do that. Absolutely. Let me
Th-
go in there.
Thank you, Simon. Simon, it went off without a hitch.
Okay, let me go to slide. Okay, good morning, everyone. I want to thank everybody for joining us this morning. My name is Veronica Alegria, and I'm with the Senior Medicare Patrol, and I am their state outreach specialist. We are also housed with the Better Business Bureau Education Foundation, so we work closely with them to help people learn more about scams and fraudulent activities that are in our communities. Currently, we are the Senior Medicare Patrol, of course. We are a federally funded program that exists in every state. And our job is to recruit and train professionals and volunteers regarding Medicare fraud and abuse. We also assist in reporting these fraudulent activities to our Medicare fraud control units, such as HHSC, CMS, FBI, the Office of Inspector General, the Attorney General, just to name a few. Our mission currently is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. The impact of Medicare fraud is in the amount about $60 billion a year, and approximately about 250,000 beneficiaries have listed their Medicare numbers as being compromised. So this is increasing. I'm not sure if $60 billion a year is currently, I believe it's gone up to 70. I haven't found any current documentation or reports, but I heard on TV one day that it was at least at 70. So what happens with Medicare fraud is that beneficiaries usually get a call or a text from someone posing as a Medicare agent or someone that works with Medicare. Just hang up. Medicare will never, ever initiate a call unless you have initiated one yourself. We'll never call you unless you've initiated a call yourself. So just keep in mind, never provide personal information to anyone posing or calling you and pretending to be from Medicare or saying they're from Medicare. Keep an eye on your Medicare summary notices or your EOBs. This is the main area where you're able to capture those errors, abuse, or fraud. In these Medicare summary notices, there is a listing of all the Medicare healthcare providers that are billing your Medicare number. So every month they're compiling this information, and in the quarterly basis, you will receive this Medicare summary notice or an explanation of benefits. You will go through that, and if you don't recognize a doctor's name, maybe a service that was paid for but you never received, please circle the item, contact Senior Medicare Patrol, or you can even call the 1-800-Medicare number, and they will more than likely direct you to us for further assistance. But just keep an eye on those summary notices, because this is where you're going to capture all the fraud. And of course, like I mentioned, you can call us at 1-888-341-6187. So to talk about our topic today is fake government imposters. What this is, if you have people posing as government officials in order to deceive unsuspicious people, and what they're doing is that they're asking for personal information, money, or even both. Some common tactics are they usually use phone calls, emails, texts, or they claim to be from agencies like the IRS, Social Security, or even law enforcement. So let's say you're going about your business, you get a phone call, and it's your local police department informing you that you have a warrant for your arrest, and you have to pay them $500 right at this moment, or they will send a unit to your home to arrest you. Okay, I've gotten these calls as well. You have to stop and think. In all actuality, is the police department gonna call and warn you that they're coming to get you? No, usually they'll just come and get you and not even warn you. And usually when they ask for payment, it's always in the form of a gift card, or they ask you wire money, or they ask for some sort of cryptocurrency such as Bitcoin. And the reason for this is because it's very difficult to trace or even get a refund back. So like I mentioned, these scammers will typically create a sense of urgency, creating fear in their victim, threatening them with arrests, fines, and if the victims do not comply, of course. So fear is usually a very easy way to convince people to pay up. Request for personal information. Your most sensitive information is your social security numbers, your bank accounts. We've had people, when the Medicare Advantage people started rolling out their assistance with public benefits, they were helping renew Medicare savings program applications. So a lot of these Medicare Advantage plans were calling their beneficiaries, asking for their information in order to fill out these renewal forms. A lot of these beneficiaries, since we go out and we advise them not to provide any personal information over the phone, we're calling us to confirm whether or not this was a practice that was currently occurring with these Medicare Advantage plans. So in essence, we at the time were not aware, so we had to do a little research and find out whether or not this was an actual event or assistance that the Medicare Advantage plans were offering, and in fact they were. So they started assisting people over the phone with these renewal applications, but what they were doing initially is informing them by mail that they would be receiving a call when it was time to renew their applications. And in essence, they were supposed to sign a consent form allowing them to do this. So just keep this in mind. If you ever get a call from a government agency offering assistance for applying for any type of public benefit, please call someone and verify, or call the actual agency they say they're calling from, not the number they're calling you from. Look up the actual number and call them directly. So signs of a scam. So some signs would be someone randomly calling you, claiming to be from maybe the FBI or the IRS with some sort of urgency. And then they'll request unusual forms of payment like wire transfers, gift cards, Bitcoin. Think about it. Why not ask for you to just draft from your accounts from a credit card? Why? Because your accounts are usually with some sort of protection. Gift cards and wire transfers, cryptocurrency have no protection whatsoever. And of course, there's the pressure to act quickly or else type of thing, causing people to act out of fear. So recent reports of fake scams include, of course, the IRS. We are in the midst of tax season, so people are beginning to receive calls from scammers claiming to be IRS agents threatening legal action. If anyone has had an experience with the IRS does not work by phone. Usually if they have something to tell you, or if it's something, maybe you're getting audited, they will send you a registered letter with signature requirement. So they will never, ever call you asking for your information or asking you to pay because you have back taxes that are going to cause you to get arrested, yada, yada, yada. So don't fall for that. Social Security scams are one of the biggest ones that scammers use to victimize beneficiaries when they pose as representatives claiming that they have issues with their benefits, and then they demand personal information in order to verify certain issues or resolve the issue. Keep in mind, if Social Security calls you, it's because you initiated a call. They will never randomly call you with issues. If they do have to discuss a matter with you, like the IRS, they will also send you a written notification by mail and letting you know that you have an appointment to speak with them soon regarding this particular issue at hand. Robocalls are another form of fake government scams. So what they do is they call, and you receive these calls, and they call them robocalls because basically it sounds like a robotic voice, and it says you are currently receiving this call from this health and human services regarding application number blah blah blah. Press 1 to be connected to an agent, and then you're connected, and next thing you know, they're asking you to verify personal information, to include even bank information. So please do not, remember, keep in mind, they're not calling you unless you have initiated a call yourself. So protect yourselves. Do not give out information until you verify this. Civil service scams, constantly getting calls from people posing as law enforcement officials, demanding payments. People say, I received a call years ago, and it was he was claiming to be from our county sheriff's department, saying that he had a warrant for my arrest and that I needed to pay him $2,000 to clear up the matter, or he was sending a uniformed agent to my job to arrest me, and he named the place where I was working. And I said, fine, go right ahead. If you have someone coming for me, let them come for me. You know where I'm at. Hung up, never showed up. They were just trying to pressure me to pay up, and I didn't, because I knew better, of course. So, according to the Federal Trade Commission, scammers have managed to steal $12.5 billion from Americans just last year. This beat the previous year's record. So the total dollars lost was about 25% higher than 2023. And according to the FTC, fraud reports remained stable. Instead, consumers were reporting losing more money, which is really scary. In 2024, some 38% of consumers reported losing money to fraud and scam. That was up from 27% in 2023. And this is according to the latest Consumer Sentinel Network data book. So reporting, we urge victims to report these scams to local authorities, the Federal Trade Commission, or other relevant agencies. Many victims hesitate to report because of embarrassment or just the stigma of being scammed. I've had friends be scammed, and I learned of them being scammed only months after it occurred because they were too embarrassed to talk about it, let alone file a complaint. So we urge you to file complaints because this helps stop or at least prevent you from being scammed again. It's always verify the identity of anyone calling you, no matter where they say they are calling you from. Use proper channels to look up these government numbers and use official forms of communication to contact the agencies in question. I am providing you with a list of government agencies in case anyone receives a call from any one of these agencies. These are the actual contact information where you can get a hold of them. Don't call the number on your phone. Those numbers are usually not correct. They're spoofing, so they're covering up or camouflaging the actual number. So to make it look like it is the FBI calling. So on this list, I have the Federal Bureau of Investigations, which is the FBI. This is their website. When logging into these websites, or if you get an email from the website, always look at the email address at the top bar. Make sure that the address is exactly as it's supposed to be. Many times what scammers do is that they'll disguise the web address, maybe add an extra digit or maybe an extra letter, or instead of .gov, it might be .com, C-O-M, or .org, O-R-G. These are very specific, so any letter, digit, capitalized letter that is off could be a sign that this is not a safe website and you are dealing with a scammer. So we have the Department of Homeland Security. This is their phone number as well, and their web address. The Department of Justice. We have the Centers for Disease Control, the Office of Inspector General. These are all their websites and actual phone numbers. We have the Environmental Protection Agency, EPA, the Federal Trade Commission, the U.S. Citizenship and Immigration Service, and of course, Medicare. This is the actual Medicare phone number, 1-800-MEDICARE or 1-800-633-4227 or medicare.gov. So what to do? What are we going to do to protect ourselves from fake government imposters? We're going to ignore any calls from any unfamiliar numbers. Never click or download any suspicious links or attachments. Always verify if you know the recipient. And if you don't, delete, immediately delete. So if you spot a government impersonation scam, you immediately report it to the Federal Trade Commission, FTC, at reportfraud.ftc.gov, or you can report it to your local state attorney general. And if you gave your personal information to a scammer, go to identitytheft.gov. Getting your identity stolen is not, it is one of the worst things that can happen. My fiance's identity got stolen years ago, and to this day, right around tax time, he has to go through a lot just to file his taxes. He needs requiring a PIN number because someone else in another state is using his social security number to work. They know where the individual is, who he is, but because he doesn't file a tax, so the government wants to bill my fiance for his taxes. So it's a big mess. It never really gets fixed. It takes a lot. It's been 8 years. He's still dealing with it. So just guard your information, because this is a type of problem you will end up with. It takes years and years to correct. So reporting, staying informed and cautious always helps prevent falling victim to these scams. It's always wise to remain vigilant and report any suspicious communications to local authorities or to the FTC. Remember, when in doubt, reach out directly to the agency in question to ensure your safety. Never call the number on your caller ID or in the text message or in the email. Look up the numbers, use the listing I just provided you with. Thank you so much for your time.
Thank you so much, Veronica.
Yes.
That's wonderful information.
Thank
So,
you.
yes, you look gorgeous as ever.
Aw, I'm at home recovering from a fall. I don't know if Angel informed you. I took a fall in January.
No.
So I ended up having emergency knee surgery. I cut my kneecap in half, so the doctors had to go in there and screw it together. So I have two screws on my knee.
Sounds like
So it's been
it.
quite an ordeal. I
Oh
have to
no.
learn to work from home, how to depend on other people. I'm a very independent person, so I'm
Yeah.
having to let people do things for me, which is very
Yes.
difficult.
No, I know, I know, I
Yeah.
know. Well, I'm glad you're on the
Yeah.
road to recovery, Veronica.
Yes. I'm
Okay.
anxious to hit the road running. I want to go out and do my outreach again. I miss being
Mhm.
out there,
Oh, yes.
you know.
I know, I know. But
There's a couple.
Marty, oh, go ahead.
There's a couple of questions I think in the chat. If you
Yes,
wanted
there
to
is.
go ahead and do, we have
Yes,
plenty of time, so I didn't know if you guys want to
yes,
go ahead and cover those first.
I
We've got 30
do.
minutes.
Yes. And then Veronica, I'm going to come back to you because I have some questions also on
Okay.
scams. One question from Maria. Do Medicare savings programs offer spin down, help with income eligibility? No, the Medicare savings program is Medicaid run, and it helps people with low income. So it doesn't involve the spin down to become eligible for that, Maria. And so we had another, I hope that answers your question. You can go ahead and put your name and number in the chat. And if I need to, I will give you a call. And so the next question, can someone explain the qualified disabled working means? That's a person under 65 with a disability that has who is working but lost their premium-free Medicare Part A. So that means that your income and your resource limits are preventing them from receiving that assistance through help with paying their Medicare Part A premiums. So again, the name didn't come all the way through. It looks like Melanie, but if you need more details, please put your number in the chat and I can call you, or you can call me. It doesn't matter. I can put my name
Yeah.
in the chat
So
also.
Felicia's information
Yes.
will be in the follow-up email. If you don't want to put
Yes.
your information in the chat, please know that Felicia's contact information will be in the follow-up email.
Mhm. And then my question, and there are some more in the chat too, Veronica, that you might want to look at about scams. But I think, Veronica, I've
Uh-huh.
read in I look at the Katy Trail Weekly, the scammers, you and Angel and all of your, people who work for the S&P have done such a great job. The scammers have decided to switch it up a little bit. They're going back old school and excuse me, they have the nerve and audacity to come to your door and demand that you pay them with your credit
Mhm.
card or with, well, basically any cash that you have, or just to, it's just to intimidate, humiliate you. And
Mhm.
they come with a fake badge that my grandson can do and a clipboard and look so official. And they might have on a uniform and they're demanding money from you. And they're targeting seniors. Have
Yes.
you all had any
So
reports of that? The nerve and audacity to come to your
we've
door, the
had,
sanctity of your home, and demand
yeah,
money from you. I just get all excited about this. This drives me to just
yeah,
tell your parents and your grandparents, do not give money to people who come to your door saying that you owe a utility bill from, 15 years ago, or you
right.
had a parking ticket. It's the nerve. that they have changed that up and decided to go, well, so many people have phones and they're used to the scam. So let's go back to what we used to do back before phones and
Mm-hmm.
computers and everyone had that. It's maddening.
Is scary. So what I did with my mom for that fear as well is I installed a Ring camera. So
Right,
whenever
right.
someone approaches her door, the Ring camera comes on and I'm able to speak out there. So if someone shows up that I'm not familiar with, I speak to them and say, you need to leave now or I'm calling the police. You know, and
Excellent.
that
Yes,
helps.
yes.
That helps. But we have had reports that are similar. They're called jugging. And what is happening here is that people are being victimized at the bank. They have these scammers or these
Oh
thieves
no,
sitting around the bank lobbies waiting for
you're
these
kidding.
unsuspecting victims. So what they do is when they see the people walk out, when they withdraw their money, they follow them home. They'll get in their vehicles, they
Oh
follow them,
no.
or they follow them out to the parking lot and take their money. They mug them or they follow them home,
Ah,
and even
ah.
worse, do them at their home. So it's called jugging, and it's been happening here in South Texas.
Mm.
So yes, you
Oh
have to
my
be aware
goodness.
they're getting more and more daring. Daylight. I mean, you're talking about banking hours, daylight,
Yes,
and they're doing
yes.
this. They're getting very, very daring, and more so now with AI. Artificial intelligence. It's just making for people like on the grandparent scam. We have these phone calls, FaceTiming people, and they're able to mimic their loved one's facial features. And the only way to detect if it's AI is if that scammer makes the mistake of moving his head this way or this way,
Oh,
it'll
really?
blur.
Okay.
It'll blur. You
Mhm.
see, when you're doing an actual FaceTime with an actual person, you don't have a blurred photo. So when it's AI, clearly, if they turn their face, you can see it
That's
blur.
one way to
That's if they
tell.
make that mistake. Yeah, that's how you're able to tell, because what they do is they fool these unsuspecting grandparents that they're in some sort of legal problem or they're needing money
Mhm.
ASAP. They're in a different country. I need $5,000 right now. And of course, the grandparents are seeing him on their phone. They think it's him, send the money.
Right.
Turns out it wasn't even him. So what in that situation, we recommend that if you have loved ones that you communicate with on the daily, maybe create a password or a word that only, or something that only you two know about, a secret family joke
Mhm.
or maybe a pet's name, and see if he's able to come up with that answer. If they can't answer that question, then you know it's not real. Reach out and call that person directly. I had this happen to my mom. She got a phone call from an uncle of mine indicating that he needed $500 because he was in San Antonio. His car broke down. He had no way to get back home. I was there when he called.
Oh,
So I asked my mom, you know what, let's call his wife. Let's see what's going on. So she called her and she told her, what are you talking about? He's sitting right here having breakfast. So she was getting ready
mm.
to send him $500. And
Yeah, it
usually
just
what they
breaks your
do,
heart. Yeah.
yeah, and what they asked her to do again, she was instructed to go get a gift card and that they would call her back in an hour and she was to give him the numbers on the back of the gift card so that he can pay whoever was going to fix the car. Yeah.
Mhm. Isn't
So they're
that's awful.
very, very creative in their ways to
Yes, they
get
are.
you. Mm-hmm.
They
Yes.
are. I know. Even with my daughter, Veronica, she lives in a gated community in Dallas, right up downtown is right there. She installed a Ring camera because people come in the gate if they see someone going out, and then they'll just come right in. And she says there's been a number of just people just walking around. And so she
Mm-hmm.
installed a Ring camera right over her door. And I thought,
We
oh,
have
you live
to.
in fairly
Yeah, you
nice.
you can't trust anyone, especially if you're one of those people that loves to order Amazon packages on a daily.
Yes, she
Your
does.
house might be a target. You know, we have a lot of these porch bandits going around just taking packages in broad daylight with Ring cameras. I mean, they don't care. They don't care. We have actual footage of them running off with these packages and they don't care. They're on camera. It's getting really, really scary.
I know, I know. Okay, there's some more questions in the chat. If the latest scam is from Kari. I'm sorry, I couldn't see all of your name. The latest new tech scam is pay toll ticket asking for to pay a past due toll ticket. I've gotten that too. It's directly
I've
out of
gotten
my
that.
bank, but I get a text and
Yes.
oh gosh, these
No,
people.
no, no, no. Yes, this is something that is going around rampantly right now. I've gotten several text messages. I even got mail. So the best thing to do if you live in one of these areas that has tolls, go to their website directly and type in your license plate number. Do not call the numbers on those letters, on those text messages. Do not click on those links because more than likely it's a scam.
Yes. Okay. I hope I didn't overlook anyone.
Um, Mulaney
Marty, do you
put the
see
phone
any?
number in there for you, Felicia. I went ahead and just
Okay.
emailed that to you
Oh,
out of
okay,
the
great.
chat.
Do you see any more questions? It's just Veronica, speedy recovery. And let's see, Jose says, keep your leg elevated. Yes, ma'am. That's Jose is right. Yes, ma'am. Do that.
Yes.
Anything else?
We want to see it. Just make sure we can
Yes.
see that boot up in the air or whatever. We want to make sure that
Actually, I'm not wearing a boot.
because it's
I
your
was
knee.
asked to walk exactly the 24 hours after surgery. He made me walk.
Oh,
Wow.
wow.
So I've been walking since. I have a bit of a limp. It was just the kneecap that was broken, not my leg. So I think it's difficult to move my knee like this. So I started at 20, then 40. I'm at 60 right now.
Oh, wow.
So
Oh,
yeah,
wow.
so
Good,
I'm
good,
able
good.
to waiting for my physical therapy still.
Making good
Oh,
progress, but that's really
yes.
good.
Yeah.
Good
Yes,
for
ma'am.
you.
Yeah, you have to because my fiance has back problems as well. So when his back goes out, we need things done. And guess what? I had to get in. I'm driving already because when his back goes out, I mean, we're just stuck here.
Oh my
We need
gosh.
to go get
Oh
stuff and
no.
yeah, so here I am driving.
Okay. Well, there's another Alexandria. She got a letter in the mail that looked legitimate from her bank, and I spoke with her. Oh, she says her aunt, and I spoke with her and went through to the bank itself, and the gentleman there told her it was a scam. It stated her account hadn't been set up correctly and she needed to contact them to reset. Good for you,
Yeah,
Alexandria,
good
that
for
you were
her.
able to take care of that. That is scary
Yeah, that would have been
frightening.
disastrous.
And
Imagine
and
that because she would have had to give them
yes,
all
yes.
the banking information. Oh my gosh. Yeah, good
hmm
thing.
And
Um,
then there's another in the chat from Sherry, a new scam saying a package from China is held up in customs because the zip code doesn't match. Came via text.
Yeah,
Told us to click on the
yeah.
link provided. Ooh,
Yeah,
that's a
and that happens a lot, and it's very tricky because we have a lot of people using Shein a lot, you know, that clothing. It's
oh
really
yes,
cheap
yes, yes,
and it's
yes,
from China.
yes.
It's cheap. So people get confused. I go, wait a minute, I did
Uh-huh.
order something from Shein. It is coming from China. But just keep in mind that usually they will send you a tracking number. Always trust your tracking number. Don't trust these text messages that they're having an issue because if there is an issue, the tracking number, once you click on it, if there is an issue, you'll see that issue on the detail in the tracking number. So
Oh,
never click on those. They're just scams. I get them on the daily, every day.
I
oh my
get them
goodness.
too pretty
Yeah.
often.
Yeah.
Me too.
Yeah.
So do I. Me too.
Felicia, there's Martina Howard wants to know what the deadline to make the Medicare Advantage changes this year. So just to reiterate, you have until March 31st for Medicare Advantage plans. And then you have to wait again until October.
Great.
Anybody other questions?
See, I was looking at the chat. Can you see the Q&A, Leslie?
Yeah, I'm seeing the Q&A. There's so many scams out there.
Okay.
What?
Someone
Yeah, and
asked
I
if you
just
could address deed scams.
Oh, yeah.
Dean
That's
scams.
a
Deed
new thing. Yes, deed scams.
with your
Oh,
house.
It's
the deed.
basically, yes. Mm-hmm.
What's
Oh,
happening here
I
in South
just,
Texas?
yeah,
Is it the deed where they're stealing property?
Yes.
Well,
yes.
you saw it on the news.
Yeah,
Remember when
it's,
someone was trying to steal the Elvis Presley mansion?
Huh?
That the notary had notarized some fake document on a loan that they had defaulted on, and because they had defaulted on this loan, that they were able to take possession of the Elvis property, the mansion. Okay, what's happening here in South Texas is that people drive around looking for abandoned properties, and then they put a for sale sign on there with a phone number to call. So we have two victims. We have the owner of the property and the purchaser. So what they're doing is that they're posing as the owner, and these unsuspecting buyers don't bother to do the research to find out whether or not the person they're speaking to is the actual owner. So they ask for the money upfront in cash. Most of these people are paying cash. They make it easy enough for them to pay cash. They'll ask for 30,000, 40,000, really, really cheap. That's a red flag. I mean, where are you going to buy property for 30, 40,000? No, no. So they fall for it, they pay them the money, and they're gone. Next thing they know, they're trying to take possession of the property. The real owner shows up because the neighbors call them, and turns out that it was never theirs to sell. So there we have them two, both at a loss. So what I've heard from the sheriff's department is if they capture the culprit, they can easily fix the problem by having the culprit sign the document and give the property back. He says he's only had one case where the thief refused to sign, and they had to go through all the court venues and stuff like that, but it is happening. So what we're asking people to do is to make sure that when the county tax assessor sends out your tax thing for the year, I think usually around April, they'll send you something saying this is what we're projecting your taxes will be by the end of the year. If you don't get one by April or the end of April, check with the tax collector assessor to make sure that your property is still under your name. Okay, because otherwise whoever sold the property may be registered, or somebody else might be getting that. So just keep an eye on that as well.
so
We also
important
heard
to do
about
that.
we have predatory towing, where people are involved in car accidents. We have these towing companies just waiting to come up and hook up your car. They're claiming to be from your insurance company, and they take your car. Next thing you know, they're charging you thousands and thousands of dollars to take your vehicle out of impound. And that's predatory towing. They are not from the insurance company. So if you're ever involved in a car accident, if someone shows up in seconds, in a matter of seconds or minutes that you had that car accident, red flag, red flag. There's no way your insurance company is going to send a wreck out, a towing truck that quick.
Yeah.
I've been in a car accident, and my insurance, it took about a good hour to get the tow truck to me, because it was them sending it. They had to call the people they have to call to get that arranged, but just be aware. I know it's kind of difficult, and this is why they prey on you, because you just had a car accident. You're not in all your senses. So they come up, hey, I got you. I'm going to take your car. The insurance sent me. You're fine. Sign here. Let's go. You don't even know because you're dealing with the police officers, you're dealing with the person that was involved with the car accident with you, and then you have this guy there, so just be aware.
And another, if your county participates in the alert system, if someone comes into the county clerk's office and presents fraudulent documents for your property, and it's generally for seniors who have paid off their home, and it's easily accessible through the appraisal district. So join that alert also for the county clerk's office if they participate, and then they can alert you if someone has signed filed documents on your property.
What is that program
That's another
called?
one.
Oh,
I'll have
county
to
clerk
text it to you. I need
alert.
to look at yeah,
Yeah,
it's
because
an alert where
I'm
you
gonna
just
I'm gonna follow
participate
up
in
with
it.
ours. I've never heard of that. So I'm
Yes.
thinking if they don't have it here,
Mhm.
I'm gonna approach them and try to see if we can get that in
Yes.
place for our seniors
It
here.
doesn't cost anything. And if someone just comes into the clerk's office and says, well, I have these documents that I'm new owner of this property, and of course it's paid off and there's no lien against
Right.
it, and they'll accept the
Wow.
fraudulent documents. And then you have your, if you pass away and your heirs are entitled to your property, then it's all kind of messed up because someone has filed
Right.
a claim to it.
Right.
It's
Right.
terrible.
Felicia, if you
It
could send
is.
that to me, I'll include that in the follow-up
Yes.
email. That would be great.
Yes. Give me a second and I'll look it up right
Well,
now.
I mean,
You
you
have
can do it
time, but I'll send
afterwards,
it to you.
but
Okay, I will. I will.
that'd be
And if
great.
anybody else wants to know that, just send me an email and I can send that out to you. I learned that when I was participated in a seminar in Rockwall, and Rockwall participated in it, and my county also participates in it.
Yeah, and I think that's
It was really
wonderful.
good
We used to
information.
have a local bank here that would alert a family member if their customer was over the age of 60 and they went into the bank and pulled out an excessive
Mhm.
amount of money. So
Oh,
they would
yeah.
have this contact person on their list to call in the event that the loved one went and pulled out thousands of dollars without a
Mhm.
reason why, to see if the family knew
Yes.
why they were pulling out excessive amount of money. So that worked for a while. They took it out. I don't know why they discontinued that, but I would love to get that back in place here at these banks, because this is where all the fraud is occurring, especially with the jugging.
Mhm.
Because
Oh,
that's
gosh,
where the
yes.
money is.
Yeah, that's where the money is. They know who to follow to the bank.
So true, so true. We
It
have to
is.
remember
It is.
scammers they're flexible, they learn, and then they share with others, and then they kind of
Yeah,
brainstorm what scams are most
they
effective in what
research.
areas.
They
Yes, they
research
do.
you. So if you're on the internet, if you have anything on there, any of your information's been shared on the internet, they know who you are, they know what you have, they know the assets, they know everything. They know who to target. They're not going to target someone
Mhm.
who's broke. They know who to target.
So true, so true. Oh,
Okay.
here's all right. Oh. Well, everybody has really kind of experienced this. This is always a great topic, Veronica and Angel, that people are need to be aware of scammers and the damage that they can do. It's so
Yeah, and
important
it's
to have
irreversible.
that.
And it's so
Yes.
irreversible sometimes, because once your money is gone, especially in those gift cards or cryptocurrency, I mean, Venmo, Cash App, all these do not have any added protection. So once you send that money, it's gone. I don't know if you noticed, if you Zelle with your bank, Zelle has now put in place certain questions before you actually press that send button. It asks you to make sure that the person you are sending to is someone you actually know, and it questions the amounts that you're sending before you push send. I think that was a wonderful thing for the banks to do, because before that, there was nothing. It was just send the money and that's it. If you made a mistake, too bad. You're not getting the money. You sent the money to the wrong person. The bank's not going to reimburse you at all because you sent it. Yeah.
Mhm. Something else, something else.
There's some other comments
Yes.
regarding towing and
Mhm.
and someone talks about a letter from the inspector at the post office. There's all sorts of things. You just really have to be watching every single email, every single phone call. If you don't know the number, let them leave a message and call them back if it's somebody you know. But that way you don't have to deal with it. If it's somebody you don't, somebody you don't know, let them leave them a voicemail. That's obviously harder at your front door. The Ring cameras are just a great idea, but I don't know that everybody has or can afford. I don't know if the old peephole still plays a role anymore. We used to all have the peepholes that we used to be able to see, and if you didn't know the person, not to open up the door. And
That's
that's
right. That's right.
really a very inexpensive solution, to be honest with you,
Yeah,
for
just don't open the door.
the front
But
door.
you have to understand that some of the elderly are so looking forward to people visiting, and they're so
Yes.
anxious to open that door just to have
Yes.
another human being to speak to, even though it's a scammer or a fraud person.
And they're
that's
so
the great
trusting.
generation.
Mm-hmm.
Yes,
Yeah.
they're
Trusty.
very trusting.
Yeah, we're
Very trusting.
very, very trusting, and you want to believe that everyone has good intentions, right? We just want to believe that, and
Right.
we also are under the misconception that nice, just because they sound nice and they come across nice, that what they have to say is
It's real. True.
is
Yeah. Remember,
credible.
Yeah.
Yeah, it's
fraud is
credible.
death with a
And
smile. They're always going to smile at you. They're always
yeah,
smiling.
Yeah.
Even on the
and
phone, you
Yes.
can tell they're smiling.
yeah,
You can tell.
they're gonna
Yeah,
earn
you
your
can
trust
tell.
through a smile and a sweet word, sweet
Yes.
words and sugar
Mhm.
and a smile, and they're gonna try
Mhm.
to earn your trust. And then if you don't, boy, you'll see
Oh, so true.
the tone change,
Oh
because
yeah.
when you start not going to get the debit cards for them or the gift cards for them, all of a sudden they get ugly and they get threatening, and
Mhm.
it changes very, very fast. And
Mhm.
unfortunately, it's really, really, really easy to fall for. And
Yeah, it is.
we've seen so many victims, and I hate it because good, smart people, they don't. It's just hard to tell. These people have really perfected their game, and
Mhm.
know how to take advantage of good, smart, intelligent people.
Mhm. And TL White put in the chat, which is so true. Thank you. Scammers are patient too.
Oh yes.
They are
Very patient.
patient. We cannot
Especially
leave
with the
that
romance
off.
scams. These
Yeah.
scammers will romance their target for months and then start taking money from
Yes.
them. Yeah, they're
And
very patient.
then TL put in Zelle is going away. They sent an email and he put that in the chat. If everyone wants to take a look at that,
I
I
think
was
it's
trying to
only
read
you
it.
have. Yeah, I think you have to have it through your bank. I don't know if
Yeah,
you
Zelle
have.
is
Oh,
through the
okay.
bank.
Yeah,
If there are any changes, your bank will inform you directly, not random text messages or emails or
but I think
letters.
he must have had a Zelle app, and that's going away. I've only known
Oh,
it
is
to be
it?
within a bank.
Yeah.
So
Yeah, it's always within a bank.
hmm he said that.
Okay.
Yeah. So I don't know.
It's 25 minutes past the hour. I'm going to go ahead and pull up the
Okay.
information on the CEUs if I can real quick here. share. Let me share them in the right place.
Oh, no. Thank you, everyone, for sharing. Oof.
Ooh, it started me all the way from the beginning. Sorry, I'm going to take you all the way through to the end. Okay. And then look what I did. I'm sorry. For those of you that are joining us for CEUs today, we're providing CEUs for licensed social workers and licensed professional counselors in the state of Texas. Understand if you have a different license in Texas or a license outside of Texas, please feel free to go through the process and get a certificate and provide it to your jurisdiction that you're required to report to. But no, there's no guarantee that they're going to accept it. I've had people tell me they've been able to use them, and I've also had jurisdictions reach out to me for more information on certain topics that we presented on. I encourage you to try it if you'd like, but that's totally up to you. We also offer certificates of attendance. All of them are complimentary. Today's webinar was worth 1.5 hours of CEU credits. You must have completed the entire webinar and stuck with us through the Q&A. We still have a couple more minutes, so you still should be on with us. You must also complete the Google evaluation survey. When you exit out of Google today, it should ask you if you would like to take a very short survey. That will take you to our survey, the Google survey, and please answer that. You must answer it if you are wanting any type of certificate, but we are asking everyone if you would please answer the survey. It's not a long survey. It just helps us report back on our goals and objectives that we set forth when we applied for funding, but it also helps us to learn from you all how we can do a better job. So please fill out the survey. If you don't, for some reason, if you don't get the link as you're closing out of Zoom, no worries. It will come to you in the follow-up email that I'll be sending out. The Google evaluation questionnaire will stay up until the 21st of this month. And please give us about a month after that to work through all the certificates to get them out to you. And then I want to talk about next month, we are going to all get together again and talk about complaints, grievances, and beneficiary resources, and prevent, detect, and report Medicare fraud. We're going to try to save us all some money by catching some of these people that are defrauding us out of Medicare dollars that are out there for us, that are being stolen from us, really. So please tune in and help us get the word out about that. Did you have anything else, Veronica, Felicia, Leslie, anybody else?
I have Linda Lewis put in the chat on the fraud property alert. She called her appraisal district and was told that her county clerk's office is where she can file for this alert. So please call your county clerk and see if there is that fraud alert, that fraud property alert in your area. Do that for your parents, your grandparents, or any family member, especially if they have paid off their home or property. It's good information. Thank you so much, Linda.
That is really good information. Anybody else? Well, I want to thank you all. Thank you, Leslie, Felicia, Simon, Melinda, thank you so much. Angel and Veronica, thank you so much. Lots and lots and lots of good information.
Thank you. Thank you.
We will wind it down and hope you all have a wonderful day.
Y'all be safe. Everybody be safe.
Thank you. And see you next month.
Bye-bye.
Bye.